Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania with Wellness Associates and Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. Doc, on today's show, we want to talk about, I think, something that is important for everybody watching, and that is the treatment of sprains and strains. Now, why do I feel that's important? Well, today, there's a lot of weekend warriors. There's a lot of people that are very kind of, don't do a whole lot during the weekend. On the weekends, all of a sudden, they're doing a pickup basketball game. They're doing doing something that they're not used to, and they end up with sprains and strains. Now, let's start off with, if you could tell our viewers, basically, what is the difference between, because a lot of them don't know, what's a sprain, what's a strain?
The sprain involves the ligaments. You're stretching the ligaments. The strain is the tendons and the muscle. Okay, so usually there's inflammation, there's stiffness, there's soreness, there's swelling. Sometimes you can even actually have a bruise. Okay, you can see the bruise right in the muscle. A lot of weekend warriors you mentioned, a lot of people, they come in, they pull their hamstrings. Mm-hmm. You got to stretch and warm up the hamstrings. You got to know use some intelligence what you're doing. If you're not trained, you're not ready for a certain sport, maybe you're not ready to play a full game of basketball.
Right,
maybe you're getting older and you're out of shape, mm-hmm. and you haven't played basketball in 20 years. Maybe you should think twice about even playing. And if you are going to play, warm up and stretch and get ready to play.
Mm-hmm. Yeah, I would think, the hamstrings, the calves, the Achilles. You always read about the Achilles problems.
Definitely.
And then when we look at sprains, I think, the easiest way to look at that is, ankles a lot of times on the outside, you get that ball that swells up, that's your sprain up into your calf. You're looking more at a strain area. Now, if somebody is right now is dealing with this, and let's just say it's a Sunday, they have this problem, what's the first step that, they should do to maybe they get in here on a Monday?
Think of the mnemonic, it's rice, okay? You rest at number one, mm-hmm. you ice at number two, definitely, you compress it to avoid further swelling, and then you elevate it. So if you're watching TV, you want to elevate the injured part. If it's your ankle, you want to elevate it. So just think of that mnemonic, which is rice. If you follow that, and then Monday, either call our office, or go to a hospital or medical doctor, and then follow up. We have a lot of things. We do physical therapy. We have a stretching program, a strengthening program. Chiropractic a lot of times relieves the pain and works with the nervous system, mm-hmm. which controls the cells, organs, and muscles. So if you get an adjustment to your hips, your low back, and your pelvis, that helps the kinetic chain into the hamstrings and the calves and the ankles. Mm-hmm. Same with the upper extremity. Adjusting the neck helps with the shoulders, the elbows, and the wrist.
Mm-hmm. And I wanted to kind of quote this because I saw this in a recent study with people with ankle sprains. And the researchers compared chiropractic joint manipulation with an anti-inflammatory medication. Everybody's used to, well, first of all, take these pills and try for an anti-inflammatory. But they found that joint manipulation was as effective as the anti-inflammatory medication in improving pain and flexibility. And it was more effective than the medication in improving range of motion. And this is basically because chiropractic adjustment sets the joint in motion, lines it up, and increases joint mobility, which helps it heal faster. Now, a lot of people, when you look at these problems, if they're going to their normal doctor, chiropractic adjustment, joint manipulation, never even mentioned.
They don't know.
Okay? It's basically like, let's, put ice on it, take these pills. They also not only, take that approach, but they don't look at how are we going to treat that afterwards to build the strength back up, increase that range of motion, to stop preventing future problems with that area.
We can accelerate the healing. We're making positive rehabilitative changes in like the study showed. Mm-hmm. We're also doing physical therapy, ultrasound, muscle stim. We do massage therapy, trigger point therapy, myofascial relief. So it's all good. It all works. It increases circulation and promotes healing. So therefore, you can take a drug, but a drug doesn't heal anything. Mm-hmm. So you can't heal with poison. You only poison with poison. So we're taking a different approach. We're doing chiropractic physical therapy, nutrition, exercise, strengthening, and massage, and ultrasound, and what have you. Mm-hmm. So that's all good. It all works.
And I think people need to understand, just because maybe the inflammation goes down doesn't mean you've dealt with that problem.
That's right.
Okay? I think too many people then fail to take that next step. And I don't think it's any coincidence that if you look at all of the top athletes that are out there,
yes.
Okay, majority of them, if not all of them, have a chiropractor that they deal with, regular, appointments, working on that prevention, looking at injuries, because they use, and I think we can learn a lot from this. When you look at a high-end athlete, they have a whole myriad of health professionals that they deal with.
Of course.
Okay, they don't put their health and their, you know, wealth really in the hands of one person.
That's right, because their body's their livelihood. So no body, no work, no money, no food, no eat, no live. They're making
Yeah.
life and death decisions.
Right. And they've
Okay.
got a team of people, you know, that are working together. Unfortunately, I mean, it's a shame that in our regular environment, that can't happen. You know, I mean, this back and forth with the medical profession and chiropractors, if everybody would just come together, one, I think from our standpoint, not being a chiropractor, just being a patient and a consumer such as you, our healthcare could be a whole lot better if everybody would take that approach
Yeah,
and
because
not
it's
battle
cheaper,
each
it's
other.
cheaper, it's non-invasive. Okay, like if you have a fly in your windshield, you can use a fly swatter, you can use a bazooka. It's going to do the same job, but what's less invasive? What's cheaper? I'd rather use the fly swatter. We're kind of the fly swatter. Okay, we do the least expensive, least invasive.
Yeah.
Okay,
So, you know, I would just encourage everybody, if you're looking at a sprain or a strain, you know, you really want to look at not just the immediate treatment of the problem. You know, a lot of weekend warriors have gone through the emergency room, okay, because it's been hurt that bad, and then it's like, we'll follow up with a doctor, get a medication, and then it's just like, okay, you're okay.
Right.
There's a lot more to it than that. So
course.
don't stop short of really treating that area, making sure that your range of motion is, you know, at 100%. Because, you know, if you have scar tissue and limited range of motion, you're going to set yourself up for other problems down the
you
road.
said the key word. As soon as you get through therapy and physical therapy, exercise, massage, chiropractic, we're going to break up the stiff, locked up areas of the spine like that study showed, and we're going to avoid scar tissue, and we're going to avoid adhesion. So a lot of people have adhesions. That's because they let it go too long. They
Yeah.
didn't get proper care. You know, the symptom is just 10% of the body anyhow. 90% of the condition is silent, sort of like the silent killer. Like heart disease is a silent killer, high blood pressure. Even your spine could be a silent killer. You could have misaligned vertebrae in your spine right now, but you wouldn't know, like a cavity in your teeth, because 90% of the nervous system is silent. So that's why it's always good to get checked after trauma, especially in kind of fall, sprain, strain. Get it checked, let's fix it, let's rehabilitate it, let's make positive rehabilitative changes, and then you're going to be better.
Yeah, I think we need to stop trying to ride it out and ride out the pain for a while.
That's
and,
dangerous.
You know, right. You have to take an immediate, you know, stance. Come in, and you know, we always talk about this, and I can't stress this enough because everybody needs to understand this. If you watch these shows, you've heard me say it. Dr. Goldberg offers a new patient evaluation that is free of charge for you. You can come down, meet Dr. Goldberg, meet the staff, see what this is all about. That is a win-win-win across the board. You cannot lose with this situation. And one, it's going to help get you, you know, educated on what chiropractic care truly is. I mean, you know, a lot of us, you know, I know when I first got started, just had a wrong kind of idea of what chiropractic was. We've kind of been, you know, down this kind of tunnel vision. Oh, you cracked my back, and that's about it. There's so much more to it. So much more that you'll learn when you come down here, and you might even, you know, you come down here for one problem, and through the maintenance program and all that could take care of a lot of other problems that you're having. So
There's no side effects to it, Terry. The only side effect is you get well, so it's really a side benefit.
yeah. So, you know, we just encourage you to pick up the phone, continue to watch these shows, you know, get educated on your health care and how to treat these problems that you have, and understand that there's always different approaches to things. And, you know, especially if you're going down a path where surgery is recommended, you know, we encourage you to just, you know, get that second opinion, do everything possible prior to getting to that point.
Sure.
Okay, that's a last resort. Sometimes it is necessary. I'm not saying it isn't. But I think there's a lot of, you know, you want to kind of exhaust all your options prior to taking that step. And that's what, you know, chiropractic care is all about, working with that person to, you know, just kind of exhaust everything that they can possibly do. So we just encourage you to continue to watch these shows, continue to get educated, pick up the phone, call Dr. Goldberg, come down, meet the staff, experience the environment that he has here. I think you'll be amazed at the approach that they take and the holistic approach that they're going to teach you about, and it's really going to have a major impact on your health. So we just hope that you enjoy these shows and continue to come back and kind of learn a lot more about what we have to offer. Got a lot of great shows coming up this month and in the months to come, and we just really you know, love bringing them to them. You know, we love bringing these shows to you and helping you better understand how you can live a long and healthy life. So thank you very much for spending some time with us today, and we look forward to seeing you on our next episode.